Hello everyone, welcome to the series on dental anatomy. In today's video, we will discuss about permanent mandibular lateral incisor, its chronology, dimensions and morphology. But before moving forward, let's start with some basic concepts. First is naming. The term incisor is derived from the Latin word insidiare, which means to cut. Next we have the positioning. The permanent mandibular lateral incisors are located in the mandibular arch. They are two in number and are present on either side of the midline. They are positioned lateral to lower central incisor and mesial to lower canine. The third point is the function. All the incisors, that is upper and lower central and lateral incisors, helps to cut or slice the food into smaller chewable parts. They are also essential for speech, that is proper pronunciation of words, and helps in maintaining a pleasant facial profile. Next we will talk about tooth numbering. As per the FDI system of notation, they are denoted using the digits 3-2 and 4-2, where 3-2 represents lower left lateral incisor and 4-2 represents lower right lateral incisor. In the universal notation system, we use the number 23 to represent lower left lateral incisor and 26 to represent lower right lateral incisor. In the Sigmondi-Palmer system of notation, these are designated using the symbol 2-2 or 2-2 that represents the right and left lateral incisor. Now coming to the chronology of the tooth. Permanent mandibular lateral incisor erupts at the age of 7 to 8 years. That coincides with the eruption of permanent maxillary central incisor. It is the third tooth in the eruption sequence after permanent first molars and permanent mandibular central incisors that erupts at the age of 6 to 7 years. The first evidence of calcification is seen at 3 to 4 months. The crown formation is completed by 4 to 5 years and the root is completed by 10 years. Next we will look into the dimensions of the teeth. The overall length of permanent mandibular lateral incisor is around 23.5 mm. The overall length of permanent mandibular lateral incisor is around 23.5 mm, of which the crown length is 9.5 mm and root length is 14 mm. The mesiodistal diameter of the crown is 5.5 mm at the crest of curvature and 4 mm at the cervix. The labiolingual diameter is 6.5 mm at the crest of curvature and 5.8 mm at the cervix. Lastly, the curvature of cervical line. It is 3 mm on the mesial side and 2 mm on the distal side. Now let's understand the surfaces, line angles and point angles. Similar to all other incisors, the permanent mandibular lateral incisor have 4 surfaces and 1 incisal ridge. The surfaces include labial, lingual, mesial and distal surface. The incisal ridge is round in newly erupted teeth. However, with time it undergoes wear or attrition due to mastication and becomes flat. It is then referred as incisal surface. There are 6 line angles. These include mesiolabial, distolabial, mesiolingual, distolingual, labioincisal and linguoincisal. That is mesiolabial between the mesial and labial surface, distolabial between the distal and labial surface, mesiolingual between the mesial and lingual surface, distolingual between the distal and lingual surface, labio-incisal between the labial and incisal surface, and lingo-incisal between the lingual and incisal surface. There are 4-point angles. These include mesio-labio-incisal between the mesial, labial and incisal surface, mesio-lingo-incisal formed by the mesial, lingual and incisal surface, disto-labio-incisal formed by the distal, labial and incisal surface, and disto-lingo-incisal formed by the distal, lingual and incisal surface. Now let's study the tooth morphology in detail from different aspects, starting with the labial aspect. The crown appears trapezoidal in shape with the shorter end towards the cervix. The labial surface is smooth with convexity in the cervical portion and a flat surface incisally. The crown is bilaterally asymmetrical. This means if we draw a line along the long axis of the tooth, the mesial and distal half are not similar, the distal half being slightly larger than the mesial half. Also, the mesiodistal width of the crown is larger than that of permanent mandibular central incisor. That is, the mesiodistal width of permanent mandibular lateral incisor, which is around 5.5 mm, is greater than the width of permanent mandibular central incisor, which is around 5 mm. The mesial outline of the crown is almost straight and is larger than the distal outline. The point of maximum convexity or the mesial contact area is at the incisal third of the crown. The distal outline is straight in the cervical region and it becomes slightly convex as it reaches the disto-incisal angle. The distal contact area is also in the incisal region, but it is more cervical when compared to mesial contact area. The cervical outline is curved with the convexity towards the apex, and the incisal outline formed by the incisal ridge is straight, sloping downward in the distal direction. Similar to all other incisors, the mesio-incisal angle is less rounded when compared to the disto-incisal angle. Now coming to the lingual aspect. The crown is trapezoidal in shape, similar to that seen from the labial aspect. It converges lingually, which makes the lingual surface narrower as compared to the labial surface. The lingual surface is smooth and devoid of any developmental grooves. It presents convexity in the cervical portion due to the cingulum and concavity in the incisal region due to the depression of lingual fossa. The crown outlines are similar to that seen from the labial aspect. The mesial outline is straight, the distal outline is straight in the cervical region and shows slight convexity towards the incisal ridge. The cervical outline is curved towards the apex. The incisal outline is straight. The mesio-incisal angle is less rounded when compared to the disto-incisal angle. The important features on the lingual aspect include the cingulum, lingual fossa, mesial marginal ridge and distal marginal ridge. The cingulum develops from the lingual developmental groove and presents as a convexity in the cervical portion. The lingual fossa is shallow and devoid of any developmental grooves. The mesial marginal ridge and distal marginal ridge are well developed and forms the mesial and distal boundary of the lingual fossa. Now coming to the mesial aspect. The crown is triangular in shape with the base towards the cervix. It presents a smooth and convex surface and its labiolingual dimension is greater than that of permanent mandibular central incisor. That is, the labiolingual dimension of lateral incisor, which is 6.5 mm, is greater than that of mandibular central incisor, which is around 6 mm. The labial outline is convex near the cervical line and then moves straight from the crest of curvature to the incisal ridge. The lingual outline is convex in the cervical third opposite the cingulum, slightly concave in the middle third, and straight in the incisal third. Cervical outline is convex, pointing in the incisal direction. The incisal outline is rounded in newly erupted teeth. However, with time it becomes flat due to functional wear. Now coming to the distal aspect. It is similar to the mesial aspect, that is, it is triangular in shape with the base towards the cervix and presents a smooth and convex surface. The labial outline is convex in the cervical portion and becomes straight towards the incisal ridge. The lingual outline is convex in the cervical portion, concave in the middle third, and straight towards the incisal ridge. The cervical outline is curved in the incisal direction, and the incisal outline is round. The key features that differentiate mesial and distal aspect include: number 1, curvature of the cervical line. It is less curved on the distal side. That is, if we remember from the previous slide, the cervical line curvature is around 2 mm on distal side and 3 mm on mesial side. The second point is location of the contact area. On the distal side, the contact area is more cervical as compared to the mesial contact area. Now coming to the incisal aspect. The crown presents an oval shape being wider labiolingually. That is, the labiolingual dimension, which is around 6.5 mm, is greater than the mesiodistal dimension, which is around 5.5 mm. The crown is bilaterally asymmetrical, that is, when we draw a line bisecting the crown labiolingually, the distal half is larger compared to the mesial half. Also, the incisal ridge is not at right angle to the line bisecting the crown labiolingually. This is a key feature of permanent mandibular lateral incisor that helps in identifying and differentiating it from permanent mandibular central incisor. So that was all about permanent mandibular lateral incisor. In the next video, we will discuss about permanent maxillary canine. Till then, if you found the video helpful and informative, then do like the video, share it with your friends, and subscribe the channel for more such content.